Oh my God, oh my God. Oh my God, these feelings just begun. I'm saying things I've never said, doing things I've never done. Oh my God, when I see you I should it right. But I'm frozen in motion and my head tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes cause my heart goes oh my God, can't believe what I've become. I'm thinking things I shouldn't think, singing songs I've never sung. Oh my God, when I see you I should run. But I'm frozen in motion and my head tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes cause my heart goes but my heart goes cause my heart goes my head and my heart, my head and my heart, I can tell them apart. It's gonna be the run, but I can't. Cause my heart goes cause my heart goes oh my God, this feeling's just begun. Saying things I've never said, doing things I've never done. Oh my God, when I see you I should it right. But I'm frozen in motion and my head tells me to stop. But my heart goes oh my God, these feelings just begun. I'm saying things I've never said, doing things I've never done. Oh my God, when I see you I should it right. But I'm frozen in motion and my head tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes cause my heart goes oh my God, can't believe what I've become. I'm thinking things I shouldn't think, singing songs I've never sung. Oh my God, when I see you I should run. But I'm frozen in motion and my head tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes cause my heart goes but my heart goes cause my heart goes my head and my heart, my head and my heart, I can tell them apart. It's gonna be the run, but I Cause my heart goes. Cause my heart goes. Oh my God, this feeling's just begun. Saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. But my heart goes. Bum 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 bum. Oh my God, these feelings just begun. I'm saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. Tells me to stop feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. Oh my God, can't believe what I've become. I'm thinking things I shouldn't think, singing songs I've never sung. Oh my God, when I see you I should run. But I'm frozen in motion and my head tells me to stop. Tells me to stop feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. But my heart goes. I can tell them apart. Can't tell me to run, but I can. Cause my heart goes. Cause my heart goes. Oh my God, this feeling's just begun. Saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. But my heart goes. Bum 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 bum. Oh my God, these feelings just begun. I'm saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. Tells me to stop feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. Oh my God, can't believe what I've become. I'm thinking things I shouldn't think, singing songs I've never sung. Oh my God, when I see you I should run. But I'm frozen in motion and my head tells me to stop. Tells me to stop feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. Where my heart goes. That's where my heart goes. My head and my heart. My head and my heart. I can tell them apart. Yes, they'll be the run, but I can't. That's where my heart goes. That's where my heart goes. Oh my God, this feeling's just begun. Saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. But my heart goes. Bum 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 bum. Oh my God, these feelings just begun. I'm saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. Tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. Oh my God, can't believe what I've become. I'm thinking things I shouldn't think, singing songs I've never sung. Oh my God, when I see you I should run. But I'm frozen in motion and my head tells me to stop. Tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. But my heart goes. I can tell them apart. Yes, they'll be the run, but I can't. Cause my heart goes. Cause my heart goes. Oh my God, this feeling's just begun. Saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. But my heart goes. Bum 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 bum. Oh my God, these feelings just begun. I'm saying things I've never said, doing things I've never done. Oh my God, when I see you I should have run. But I'm frozen in motion and my head tells me to stop. Tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion and my head tells me to stop. But my heart goes. Cause my heart goes. Oh my God, can't believe what I've become. I'm thinking things I shouldn't think, singing songs I've never sung. Oh my God, when I see you I should run. but I'm frozen in motion, and my head tells me to stop. Feelings I feel about us. Try to fight it, but it's never enough. My heart is hurting, it's more than a crush. Cause I'm frozen in motion, and my head tells me to stop. But my heart goes bum, 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 bum.
Assalamualaikum and a very good morning to all of you. Ladies and gentlemen, we are about to begin in a few more minutes. Before we start, I have a few housekeeping notes to make. Firstly, I would like to seek your cooperation in completing this webinar by scanning the QR code that will be displayed before the event starts. From now on, the QR code will be available for 30 minutes. Thank you.
I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew a map to a better place. But on that road I'm sucker for. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And you said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I hear your voice in my sleep at night. Hard to resist temptation. Cause something strange has come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And you said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Oh. Yeah. I was there for you all in your darkest time. I was there for you all in your darkest night. I was there for you all in your darkest time. I was there for you all in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And you said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew a map to a better place. But on that road I'm sucker for. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And you said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I hear your voice in my sleep at night. Hard to resist temptation. 'Cause something strange has come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where were you when I was out my list down on my knees. And you said you had my back, so I wonder where were you. Came back to me, so I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Oh. Yeah. I was there for you. I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew up to a better place. But on that road I'm sucker for. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are when I was out my list down on my knees. And you said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I hear your voice in my sleep at night. Hard to resist temptation. 'Cause something strange has come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are when I was out my list down on my knees. And you said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Oh. Yeah. I was there for you, in your darkest time. I was there for you, in your darkest night. the least to you. I'm not the least to you. Ain't nothing I can do. I'm not the least to you. Following, following to you. I'm not the least to you. Ain't nothing I can do. The least to you. Following, following, following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew a map to a better place. But on that road I'm sucker for. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And he said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following, following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following, following. I hear your voice in my sleep at night. Hard to resist temptation. Cause something strange has come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And he said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following, following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Oh, oh, oh. Oh, oh, oh. Yeah, yeah, yeah. Oh, 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 I was there for you, oh, in your darkest time. Oh, I was there for you, oh, in your darkest night. Oh, I was there for you, oh, in your darkest time. Oh, I was there for you, oh, in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And he said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following, following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew a map to a better place. But on that road I'm sucker for. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees. And he said you had my back, so I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following, following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following, following, following. I hear your voice in my sleep at night. Hard to resist temptation. Cause something strange has come over me. Now I can't get over you. No, I just can't get over you. I was there for you following the map that leads to you. The map that leads to you. Nothing I can do. The map that leads to you. Following to you. The map that leads to you. Nothing I can do. The map that leads to you. Oh, oh, oh. Oh, oh, oh. Yeah, yeah, yeah. Oh, oh, oh. I was there for you, oh, in your darkest time. Oh, I was there for you, oh, in your darkest night. Oh, I was there for you, oh, in your darkest time. Oh, I was there for you, oh, in your darkest night. But I wonder where were you when I was out, I was down on my knees, and you said you had my back. So I wonder where were you? All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew a map to a better place, but on that road I took a fall. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are when I was out, I was down on my knees, and you said you had my back. So I wonder where we are. All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I hear your voice in my sleep at night. Hard to resist temptation, 'cause something strange has come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where were you when I was out, I was down on my knees, and you said you had my back. So I wonder where were you? All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Oh, oh, oh. Oh, oh, oh. Yeah, yeah, yeah. Oh, 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 I was there for you, oh, in your darkest time. Oh, I was there for you, oh, in your darkest night. Oh, I was there for you, oh, in your darkest time. Oh, I was there for you, oh, in your darkest night. But I wonder where were you when I was out, I was down on my knees, and you said you had my back. So I wonder where were you? All the roads you took came back to me. So I'm following the map that leads to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following to you. The map that leads to you. Ain't nothing I can do. The map that leads to you. Following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew a map to a better place, but on that road I took a fall. Oh baby, why did you run away? I was there for you in your darkest times. I was there behind my back, so wonder where we are. All the roads you took came after me, so I'm following the map that leads to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following. I hear your voice in my sleep at night. Hard to resist temptation, 'cause all these strangers come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees, and you said to have my back, so I wonder where we are. All the roads you took came after me, so I'm following the map that leads to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following to you. The map that leads to you, ain't nothing I can do. The map that leads to you. Oh, 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 yeah. Oh, oh, I was there for you, in your darkest time. I was there for you, in your darkest night. I was there for you, in your darkest time. I was there for you, in your darkest night. But I wonder where you are. When I was out, I was down on my knees, and you said to have my back, so I wonder where we are. All the roads you took came back to me, so I'm following the map that leads to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following. I miss the taste of the sweet life. I miss the conversation. I'm searching for a song tonight. I'm changing all of the stations. I like to think that we had it all. We drew them to a better place, but on that road I took a fall. Oh baby, why did you run away? I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees, and you said you had my back, so I wonder where we are. All the roads you took came after me, so I'm following the map that leads to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following. I hear your voice in my sleep at night. Hard to resist temptation, 'cause all these strangers come over me. Now I can't get over you. No, I just can't get over you. I was there for you in your darkest times. I was there for you in your darkest night. But I wonder where we are. When I was out, I was down on my knees, and you said to have my back, so I wonder where we are. All the roads you took came after me, so I'm following the map that leads to you. The map that leads to you, ain't nothing I can do. The map that leads to you, following to you. The map that leads to you, ain't nothing I can do. The map that leads to you. Oh, 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 yeah. Oh, oh, I was there for you, in your darkest time. I was there for you, in your darkest night. I was there for you, in your darkest time. I was there for you, in your darkest night. But I wonder where you are. came back to me. So I'm following the map that leads to you. That leads to you. Nothing I can do. That leads to you.
Assalamualaikum and good morning to ladies and gentlemen. A gentle reminder that the QR code will be closed in 5 more minutes. Thank you. Assalamualaikum and good morning. My name is Soleha Nasri and I will be the moderator for National Intermediate College Colloquy 2021 for today. On behalf of IMCC committee members, I would like to extend a very warm welcome to all of you. We appreciate you for finding time and visiting today's webinar because the topic that will be discussed for today is the role of leadership in medical career. First and foremost, continuing our event, we'd not like to introduce our speaker for today, who is Dr. Zainal Adin Zainal Abidi. Graduated from the Bachelor of Medicine, Bachelor of Surgery and Bachelor of Obstetrics from the Royal College of Surgeons in Ireland. He also graduated as a Doctor General Surgery from National University of Malaysia. With his dedicated, hardworking and determination, Dr. Zainal has published many journals on medicine. As an honour and achievement, he bestowed the Darjah Kebesaran Sultan Ahmad Shah Pahang Yang Amat Mulia Setia Mahkota Pahang on the 28th of July 2016. Before we start, let me explain how you can communicate with us during the webinar. If you have any burning questions during the presentation, just write them down in the comments down below. We will have a Q&A session at the end to answer your questions. Without further ado, let us welcome our guest for today, Dr. Zainal Adin.
Hi, Assalamualaikum warahmatullahi wabarakatuh. Very good morning. Firstly, I would like to say big thanks to organizer for inviting me to talk about leadership. I guess when Sabrina, the medical student from UiTM, who invited me, asked me to give a talk about leadership, I just jumped at it because being the eager beaver that I am, I was really interested in talking, regardless of whatever the topic might be. Initially, I thought that, to be honest with you, this is the first time that I've heard of this event, and I think it is such a interesting event, and it has huge potential in the future. Well, thank you for the introduction. I graduated from Ireland, and then I continued on as an Army medical officer. So I have served internationally and locally in many locations. Big highlight of that would be being with the United Nations, and that was really an interesting experience, and it has helped me grow a lot as a person and in terms of understanding what leadership is outside the clinical realms of medicine. So when I talk about an introduction to myself, I never fail to associate myself with these two organizations. And you can move my slide, please, if there is a slide. Yep. So if you can see the slide, yeah, so that's the cover page. And the next one would be two logos that I associate myself with. And I am really, really fond of these two organizations. The first one is MedTweetMy. I'm sure if you are on social media, especially on Twitter, you know what MedTweetMy is. We are a non-governmental organization, a medical NGO with a formal name of Medical Tweet Malaysia. Initially, its inception in 2016, we had the same goal as to dispel any myths about medicine, which are plaguing our community with so many misinformation, and we initially set up to really talk to the public and really make people understand why clinicians do what they do, what are the common myths, and Alhamdulillah, we have published a book with regards to the medical myths. It's called Perang Melawan Mitos, and I'm sure there will be another book coming out because there are so many myths, especially with COVID-19 pandemic for the past 2 years. We have been hearing so many misinformation, and I think it's time to step up and really dispel those myths. The second one would be BJUI Compass. The BJUI Compass would be British Journal of Urology International Compass, where I am a consulting editor for that journal. It is an international journal. It's open access. It's mainly urological papers, and very pleased to be a part of this budding new journal. So these are the two organizations that I associate myself with whenever I get introduced or whenever I try to introduce myself. I'm very proud of it, and I hope that you guys check it out and really be part of the community of Med Tweet My, or even read BJUI Compass online. So let's begin our talk today with a question. How many of you here are comfortable with calling yourselves a leader? I really do miss physical conferences, and I do miss getting a show of hands. Since this is an online platform, I can't really get show of hands. I can't see people, I can't talk. So, but whatever it is, if you're watching, think about it. Are you comfortable being called a leader? So when I was researching this topic, I was really thinking to myself, am I comfortable being called a leader? Because I'm really fairly new in the faculty of medicine, UiTM. I am not even a head of department. I'm not even head of unit. I'm still in training, basically. So will it be fitting for me to call myself a leader? So let's get back to that question in a bit after we have dived a little bit more into the topic. So as with all talks that I give, I really like to define the topic so that we get ourselves aligned and we understand what we want to listen and what we aim to get from the talk. So can you move to the next slide? All right, so this is a simple slide talking about the definition of leadership. So the dictionary definition of leadership is the action of leading a group of people or an organization. First time I heard it, I was like, oh, this is so dry. I mean, it doesn't really bring character to the word leadership. It's a big deal. It's a big issue. And the definition seems a bit, lame. So like very dry. It doesn't really make me think about leadership in a bigger picture kind of way. So, but I guess that's what the dictionary is all about. It gives the definition, and it's up to you to really paint the picture and define the word according to what your life and what your experiences are. So, as I was researching the topic in preparation for this talk, next slide, please. So, I've come across a multitude of definitions by influential people, mainly in business. If you go online, you can see that there are many definitions of leadership, and most of them are by business leaders, because oftentimes businesses are associated with leadership. We rarely get any leadership quotes from a physician, from a doctor, because it is not a main focus in healthcare. Leadership is sort of like behind the scenes kind of thing, which I think is really wrong. And we should have more focus on leadership in healthcare. So each of the key opinion leaders, influential figures will have their own definition. And I'm sure you and I, we all have our own definition of leadership. I put into perspective on this slide is what Bill Gates thinks about leadership. So he put it as leaders will be those who empower others. I disagree basically with this definition. I think it's a little bit too simplistic, and it can be elaborated to a larger extent. We'll get to that in a bit. So, but before we start to say and analyze what leadership is, let's talk about what leadership is not. Leadership, number one, most importantly, and this is a rampant in our country, leadership is not about seniority. Let's get that through to everybody who is watching, and let's get that into the other people's heads as well. Leadership is not about seniority. Leadership is not about position in the hierarchy of a company. So a lot of people talk about leadership as being a senior person, a senior executive in an organization, a senior doctor. If you have experience talking to medical officers, you know that in medical officer pool there will be a chronic medical officer who will be a leader sort of, because he is the senior, and that is not correct. Hopefully, as you get senior, as you get more experience, you will be a better leader, but oftentimes it is not the case, and there are no guarantees of you being a good leader if you are senior. So that's number one thing of what leadership is not. Number two, leadership has nothing to do with titles. You might be Dato Sri, Dato, whatever, you might be, even your title is a doctor in the future. People might put you into a leadership role and might expect doctors to become leaders. But leadership is nothing to do with the title. If you have a title, it doesn't automatically make you a leader. So if you do need a title to lead, then I think there's something fundamentally wrong with the structure of that organization. You can be a leader if you are a simple person. If you are just an NT or whatever, the title doesn't really mean anything. And that is what we need to get people to think about and really understand, that there is no need for a title to become a leader. Number three, leadership has nothing to do with personal attributes. So close your eyes and think about a leader. What comes into your mind? When you talk about who is a leader, people will oftentimes think about somebody big, somebody domineering, somebody with a loud voice, somebody who is taking charge and charismatic. But leadership is not an adjective. It cannot be defined as one word. We don't need extroverted, charismatic traits to practice leadership. And those with charisma don't automatically lead. So it has nothing to do with personal attributes. Definitely, you can be a leader if you talk normally, if you if you're non-domineering, if you don't take the mic each time there is a seminar, so you can still be a leader. Number four, leadership isn't management. This is the biggest thing that is oftentimes confused when it comes to leadership and management. A lot of people are managers, but managers don't necessarily make leaders. Managers operate by means of a top-down approach, with means of a schedule, maintaining schedule, calculating budget, or with orders from the above. So leadership and management are not synonymous. So if you have 15 people in your company or organization, or even your houseman pool, good for you, and hopefully you can manage them properly, create an on-call roster and all that, but it doesn't make you a leader. Good management is needed, I gotta say, but leaders should lead people rather than manage. So the next slide will be about, this I guess is the definition of choice for me when you talk about leadership. Leadership is a process of social influence which maximizes the efforts of others towards the achievement of a goal. So this encompasses the element of influence, the element of getting people to do things or affecting people to a cause and to achieve a goal. So that is, I think, a complete definition of leadership. So if you are interested in psychology, you must know that there are three major leadership theories. Number one is transformational, number two, situational, and number three is servant leadership. Let's get to transformational leadership. So the theory of transformational leadership contends that leaders stimulate others to transcend their self-interest, to reach a higher order goal or vision. So this emphasizes the ability to motivate others by raising awareness of idealized goals and through role modeling, especially. In the transformational model, leaders, they increase or release human potential through empowerment and the development of followers. So if you look at the current landscape, whatever's online or in the world at the moment, you look at Elon Musk. Elon Musk style leadership is best defined as transformational. He really pushes the boundaries of what can be done by humans, and in his organization, he believes that there is a better way to do everything. And he sets his sights on constant improvement. He doesn't like to be on a static platform. He has big ideas, and he affects people to really agree and work toward achieving his big ideas. So that is transformational leadership. Number two will be situational leadership. A situational leadership effectively depends on choosing a leadership style that is appropriate to the followership. So you are adaptable to your followers. Situational leaders, they shift, they are flexible, they are able to direct, they are able to coach, they are able to support, they are able to delegate. So all this is in response to follower readiness. If you look around, you have to agree with me that politicians or community leaders are situational leaders because they are able to lead according to the followers' readiness. Rarely enough transformational leadership works in communities because the followers are not ready and are not bound to be ready. So situational leadership examples are our local community leaders, our politicians. Then the third one will be a servant leadership. Servant leadership argues that the influence of the leader comes from serving others. So servant leaders are usually good listeners. They usually empathize, they accept stewardship, and they actively develop other people's potential. An example will be Mahatma Gandhi. Mahatma Gandhi was deemed to be dangerous by the British government during his time, but he strongly believed that the way to affect change would be to serve others. His protests were mainly peaceful. It was through logical discourse and fasting, and at the end he won. He freed India from colonialism. So, because he's not domineering, he's not somebody big. So, servant leaders, he served a lot of people, and these people look to him for inspiration. So, when you get to these three main leadership types, I'm not saying that you need to identify early and really pick a style of your choice. I am merely advocating that you understand these three concepts, styles of leadership, and mix and match and create a leadership style for you. One way or the other, everybody needs to be a leader, especially medical students. Okay, so the next slide is leadership medicine. But before we go to that, think about the question I posed earlier. I posed, do you identify yourself as a leader? So after listening to the leadership styles, looking at the examples, do you identify yourself as a leader? Are you comfortable being called a leader? Well, I've asked this question a lot of times, actually, to crowds, to friends, to family, and to be honest, most people are not comfortable to be called leaders. And essentially, I blame it on the overhype of leadership. What do I mean by overhype of leadership? I feel that we, in the course of our lives, we have made leadership something so big. It is bigger than us. It is beyond our norms. And we have made leadership essentially about changing the world, changing a country, and we take the title of a leader, and to us, we hope that someday we will get that title. We will deserve that title. And the notion to be a leader right now would be misconstrued as being cocky, being arrogant, and it has made us be uncomfortable with being called a leader. So I worry that this trend goes on, and this is already happening, and we rarely look at ourselves as leader, and we don't celebrate the things that we do. We only celebrate things that are so massive in magnitude and can only be done by a certain amount of people. And we are convinced that we are incapable and whatever we do is insignificant. And we are convinced that only these largest things are the only things worth celebrating. When we do that, we devalue our own experience. So we put little emphasis on what we do on a day-to-day basis. It takes us away from the glory of achieving things. And this is very dangerous, as we are not going to be very happy with ourselves when we achieve something, because we always put other people's achievements on a pedestal and look at people changing the world, doing big things, etc. So my call to action today, when we talk about leadership to budding medical students who will become my carers in the future, is that leadership should be redefined. Leadership should mean small things that you and I can do which affects other people and improve their lives. So it is simple. It is as simple as getting your siblings to paint the house. That is leadership. It is as simple as getting the nurses to take blood pressure on time. It is as simple as that. It is a small but very, very, very significant achievement. And I hope that everyone be happy and gives themselves credit for being able to do small things like this and identify yourself as a leader. So, it brings us now to leadership in healthcare. Leadership is integral in the healthcare setting. Up front, I've got to tell you, I have been a doctor for the past 14 years, and leadership is very, 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 very important. Doctors are trusted into leadership roles as soon as they graduate with minimal training or conditioning. We are expected to manage doctors, manage our colleagues, manage our patients, manage an on-call roster, manage an operating theatre list when you get to work. And all of this is to achieve a certain goal. Isn't that what leadership is all about? Sadly, we are not trained for it. So all this requires leadership. And moving along in your career, as you go on forward to become a house officer, a medical officer, a specialist, and consultant at the end, these leadership roles get larger. And the amount of people, individuals, and situations that you need to affect, that you need to change or you need to bring together becomes larger. So this is, I'll give you an example of how things get larger. When you are a houseman, you manage the roster, the houseman roster, who comes to work at what time, do they come, do they take MC, do they take emergency leave, and so on. So as you become a medical officer, this gets bigger. You are now expected to manage all the medical officers plus the house officers as well. You've got to manage your colleagues. You've got to lead your colleagues towards achieving a certain goal. For example, infectious disease protocols. You want to minimize the rate of infection in your ward. There's a certain goal, and you've got to motivate your friends, your medical officer friends, and your house officer friends to really get to that goal. So this is an evolving landscape of leadership that every one of you will have to go through when you graduate, and it gets larger, it gets difficult, it gets a little bit more and more and more demanding of your time and attention. As a specialist, I am exposed to leadership in a larger scale. I am now expected to become key opinion leaders when people refer cases to me from other departments. Previously, it is just our own department. So it's easy, everybody speaks their own language. But now when you are a specialist, you are expected to participate in multidisciplinary team meetings. You are expected to manage patients which are not on your service, co-manage medical conditions together with other specialties, and to bring people to the same goal of achieving good patient outcomes. So having said all that, I doubt that there is a moment in a clinician's career that he or she will not utilize leadership skills. This brings us to clinical leadership. So in contrast to managerial leadership operates through a hierarchy, superior subordinate sort of like relationship. Clinical leadership has a collegiate orientation where the focus is the patient, and regardless of wherever you are in the organizational structure, you have got to really work together to achieve that outcome. While some clinical leaders, they hold positional authority, the influence comes from characteristics such as clinical credibility. Of course, the specialist demands a bit more attention than the medical officer, just because the specialist is a specialist. He has been trained and he has a bit more clinical acumen and knowledge in certain part of medicine. However, that doesn't make the specialist a leader. So if, sorry, excuse me, we talk about clinical leadership is patient-centered. Regardless of who you are, if you get a team of people to treat the patient and improve their health outcome, then you are a leader. And this involves collective and collaborative behaviors. Clinical leadership is not an exclusive domain of any particular group. Not necessarily only doctors will become leaders in the clinical world. Leaders can come from all aspects of healthcare professionals, be it a nurse, medical assistant, even a radiographer or whatever. Everybody can become a leader, and it is not something that is only controlled by doctors. Anybody in the healthcare team is identified as a leader. As I've mentioned earlier, clinical leaders need to be seen as credible. That is, to be recognized by colleagues as having clinical competence and communicate with members effectively, especially in multidisciplinary and clinical teams. So clinical leaders effectively require qualities that reflect positive attitude. They have the courage and capacity to challenge the status quo, address healthcare issues, and engage in reflective practice. So that is clinical leadership. Clinical leadership is entrusted to you from the get-go. You are a leader to do things for the patient. So don't make it too big. Don't think that leadership is something that is huge. It may be as simple as getting the patient discharged on day 3 post-operatively. That is leadership. All right. So, with regards to this slide, leadership in medicine. The point number 1, leadership is not taught or reinforced formally at any level of the medical education. And oftentimes, leadership is not taught directly. It is bundled up together with other modules such as communication skills and empathy. But we got to understand that medicine involves leadership. Like I've said earlier, all doctors will take on significant leadership potentials, responsibilities over the course of their career. We are not taught. I've got to give that as somebody who has gone through medical school and postgraduate studies. We are not taught leadership. We are expected to lead, but we are not taught to lead. So, medical education at the undergraduate level focuses on diagnosis, management of disease. Little emphasis is put on systems issues surrounding healthcare deliveries and outcomes. I bet you when you graduate after 5 years of medical school, you are unaware of how our nation's healthcare system is. What is our healthcare policy? What is the healthcare policy of our neighboring countries as well? And I think that this is something that needs to be rectified in the future, so that we create more holistic, well-rounded doctors who are able to serve anywhere in the world. Leadership and management education are not well developed at the undergraduate level because there is limited literature on how to incorporate them effectively into the curriculum. In fact, one survey done in the United States showed that 85% of medical students thought that they should be taught leadership. They should be taught how to communicate. They should be taught how to manage a team, and they should be taught how to improve quality from the get-go in medical school. These leadership courses are available at the moment for people who have started their career, who have gone through the mill of housemanship, medical officers, and who have done things, I must say, in a routine of trial and error. And they have only developed an interest in leadership quite late in their career. I must say that leadership must be taught from the early days of the medical school. From day one, people who enter medical school need to be aware that they will be leaders in the future. A study done by Coleman also reported the qualities of participants in determining leadership. Everyone would want to say emotional intelligence, so self-awareness, empathy, cultural sensitivity, professionalism, and then these are the traits that have key positive outcomes when you want to develop people for leadership roles. Even though medical institutions have designated leadership as a core medical competency, you are expected to lead when you become a houseman and so on and so forth. It is rarely taught. It is rarely reinforced. So, despite a huge body of evidence pointing to leadership as having a positive effect to patient outcomes and also healthcare related outcomes, there is still no formal leadership training in medical school. As more evidence pops up to tell you that leadership is very important in clinical practice, it is becoming clear that training should be formally integrated in the medical curriculum. Excuse me, sorry. Can you move on to the next slide, please? Okay, so when discussing leadership, I like to do case studies. I like to take a situation and really dissect through the situation, understand why it happened, what is the analogy, the chronology to it, and really identify what we can learn from it. Let's look at something which has been very, very viral, I think, as of last month or so, and we have seen the effects of it end of last month. So it is the Hartal Doctor Contract Movement. If you are unaware of it, you should. It is about medical officers are not being offered permanent posts, are not being offered opportunities for postgraduate training, leaves for special situations, etc. It all started when they have realized that they should demand more. They want what they are supposed to get. They want what the seniors are getting. And I think that's a fair request. But if you look at Hartal Doctor Contract Movement as a leadership example, you see that the leaders of the Hartal Doctor Contract Group have been able to group together people, peers, not subordinates, peers, people who are their peers, to group together and to affect change in what they wanted to achieve, which is being absorbed to permanent posts in government positions. So, despite having multitude of warnings, etc., being told that you're gonna get suspended, you're gonna get disciplinary action, and all that at the beginning, they push through. They are severely influenced by their leaders to push through and get this done. And I think there has been an announcement on this situation, and things are looking up positively for them. And but however, I think they are still moving on because they are still not getting exactly what they want. They have garnered support from the community as a leadership, as their leaders have intended to get. Community is behind them. A lot of doctors, senior doctors are behind them. So this has shown that the leaders of the Hartal Doctor Contract Movement as being very effective leaders, and they are capable leaders, and they are doctors who are able to lead. In its raw essence, this is an example of leadership. You influence a group of people to affect change towards a specific goal. Many opinions might be given about how they are doing things, why they are doing things, especially in the pandemic and all of that. But I guess that's a discussion for another day, and it's irrelevant to the topic today. The topic today is about leadership. Leadership is getting people together towards a focused goal, and that is what they have managed to do. The point is, what I'm trying to say is that leadership is in everyone. Everybody can become a leader. It doesn't matter if you are a junior doctor or whatnot. If you can get your peers and you can get superiors to really agree with you, then that is the hallmark trait of a leader. That is something that is very commendable, and it is just that we have minimized these small accomplishments, and we really don't see it as something leader worthy. So we are all leaders, and we depend on each other. The next slide, please. Excuse me, sorry. So when it comes to leadership and its role in healthcare career, I think we have gotten through why leadership is very important and many aspects of clinical healthcare life where leadership will be able to be applied to. So next we move on to what should be taught in medical school to get more medical students to be aware that they can be leaders and prepare them for a life of leadership. In the medical curriculum, I believe that there are two aspects of leadership needs to be formally taught and assessed, and these things should be regularly conditioned in the medical students to prepare them for a life of leadership in clinical healthcare. So in medical school, medical trainees spend years learning about physiology, anatomy, biochemistry. There are a few formal avenues through which trainees learn fundamental leadership skills, such as how to lead a team, how to confront problematic employee, a problematic colleague, how to coach and how to develop others, and how to resolve conflict. These skills are not taught in medical school. So there is a need to revamp the existing curriculum to accommodate with the need of leadership for leadership training. And leadership training should be as rigorous as developing clinical reasoning or clinical skills. It's very important that we focus on leadership in medical school as a means to develop more well-rounded doctors in the future who are able to adapt and survive the dangerous environment that is your working life. Number one will be interpersonal literacy. So we are in more or less a constant state of interpersonal communication. We relate to other people from person to person around ordinary and complex human transactions in our daily life. We talk to a lot of people, and we are expected to connect with a lot of people as we take a history, as we manage a patient, as we get scans from the radiologist, as we get a special blood test, as we get blood from the blood bank. We are expected to connect and relate to the other person effectively. So that is a part of interpersonal literacy. Talking and listening are so natural that we oftentimes take them for granted. We can talk, but the other person might not listen. The other person can talk, but we might not listen. So how do we get people, us, medical students, doctors, to learn to talk and listen effectively? Previously, we are expected to absorb language in the environment through just listening and might not be listening. If you get what I mean, you might listen, but you not be really listening. So we need to change that. We need to teach medical students to listen effectively. And in that essence, when you listen effectively, you are able to communicate more effectively. Learning effective interpersonal communication skills is not about having a broad vocabulary. It's not about putting in big words. It's not about getting people confused with what you're trying to say. A lot of jargons in your conversation might not mean that you are communicating effectively. Some jargon is helpful clinically. You get a lot of points across, but if you are able to achieve understanding between the two parts of the conversation, then you have failed. And this is where I think that it is imperative we take the issue of interpersonal communication more seriously, as it is the lifeblood of human relationships. As we are social and rational beings, and we need to really understand and communicate effectively. To put into context, knowledge and training to effectively handle communication, to coordinate the team, and to train one another, and especially another aspect is to accept criticism. Involves effective communication. Another aspect of interpersonal literacy that I think is very important to be developed amongst all medical students is public speaking. all doctors should be able to give a pretty decent presentation and should be trained to and taught to on how to prepare and give a public talk. Doctors should at least be able to present a proper CME. Doctors should at least be taught how to prepare PowerPoint slides which are not too busy. You know, these are the basic things that we are expected to know, makes us more attractive, but we are not taught, which I think is unfair. So that is interpersonal literacy, which I think is something that we need to teach formally in medical school. Number two is systems literacy. Systems literacy combines conceptual knowledge of system properties and behaviors, and reasoning skills at multiple levels of perspective within a system. So when we are systems literate, we are able to stop blaming a single cause for the challenges that we face and look at the system as a whole and look for multiple cause and effect and other unintended impacts. So in other words, this means that when you are system literate, you are aware of the whole process. And when something goes wrong, you are not pointing to only one person or one factor, but you are actually thinking in a systematic way and putting everything into play. You are analyzing everything and how everything can be done to make things better. We need to move beyond lists and bullet points to a pattern of interaction that are complex as the world that we live in. So we want our solutions to create more solutions rather than create more problems, as oftentimes it is. We are caught up in the cover up mentality or gali lubang to tutup another lubang punya mentality, because we are not thinking in a way that is systematic and we are not seeing the system as a whole. So I think that there is a need for people to be taught systematic literacy and so that we can move forward and create more solutions to problems. We look at everything when we are systems literate. We look at the economy, the climate, the education, energy, poverty, disease, and other community systematic issues. Nothing stands alone when you are systems literate. Nothing stands alone. So my climate is your climate, your disease is my disease, and your shortage of items or material are also my shortage of items or material. So when you are systems literate, you are able to process this information, analyze and identify that it is a whole system problem and put into solutions, multiple solutions that create more solutions. So in the UK, the medical leadership competency framework is what they have done to put into play, putting in leadership skills into the curriculum. They have put it in their website and said that this is a method to develop leadership skills. They have embedded it into the medical school and also the postgraduate curriculum. So it involves 5 points. Number one, they should demonstrate personal qualities, develop self-awareness. You need to be able to manage yourself before you are managing others. You need to have continuous professional development, and you need to act with integrity. Number 2 is working with others, where you develop networks. Number 3 is managing services, where you plan and manage resources around what you have and improve services, where you want to ensure patient safety, you want to evaluate, you want to critique, you want to encourage improvement. And also number 5 is you are expected to set a direction. On all these things are embedded into the curriculum. It is not formally taught as a module, which I think is not the way, it should be the way to go. Leadership should be taught in the module and embedded. You can't expect people to suddenly get self-awareness of leadership by just putting in factors into the curriculum. It should be formally taught and assessed. So in clinical healthcare, there is a wealth of opportunities for trainees to get involved in activities to develop their leadership skills. from quality improvement to structured program. So they can achieve this within the program or through a specific time out of their training. You can take time off, which I think a lot of medical schools are doing overseas. People take time off to pursue other interests and continue on when they are ready, which I think is not the way things are being done here. And also should be something considered in the future. So, like I've said earlier, leadership and management are not the same thing. It's not synonymous. And in medicine, in healthcare, when you are put in a position of management, you are oftentimes faced with cynicism by other clinicians. So you get faced by inappropriate and careless remarks, such as when you are going to management, you are moving into the dark side, so on and so forth. So these are not productive comments. Comments such as these are comparable to the hierarchy of specialties within profession and often fueled by lack of understanding. So when we develop systems literacy and interpersonal literacy, we become a bit more sensitive and aware of these challenges that happen and realize that it is not just one cause that is the cause of a problem, but actually the whole team is at fault. So negativism towards leadership and management exists today because we have misconstrued management as leadership. They are very unhelpful and should not be the way things are done. If left unchecked, if left uncorrected, then there will be a big issue between medical profession and the health service managers, as what is happening at the moment. If you are aware and if you are in the loop, there is a big problem when it comes to managers and clinicians. But most people don't realize that we are in the same team and we should be able to work together to achieve a common goal. Right. So I would like to bring your attention next to a book that I've been reading, which I feel that is very, very interesting, and it is very integral for people who will manage other people, namely doctors, who understand. The book is called Surrounded by Idiots, right? So Surrounded by Idiots is a tool to improve your interpersonal literacy. This book will entail on how you will identify people, and this book has coded personalities into colors: red, yellow, green, and blue. So I'm still in the process of reading it. I have not finished, but I think it's a very interesting book, and people will really, you should really read it before you get into clinical practice, so that you identify patient behavior, personalities, and manage them accordingly. So when you talk about leadership being put into the curriculum, next slide, please. So there can be multiple methods. It can be either through didactic teaching or continuous professional development. And when you are working, you should take time off for a retreat, for a leadership retreat, to refresh and retrain. And this needs to be discussed by the medical educationists and administrators, so that we can really enforce and condition our doctors to become a bigger leader in the future, as their responsibilities will become larger. As they rise in the medical ranks and gain more responsibility, their ability to engage and lead should be different. And this is a continuing process and continuous professional development aspect. Other than learning new techniques or new methods of treatment, people need to be exposed to newer or refreshed in leadership methods. Okay, so that's all that I have for leadership. It's not a lot of things to talk about, because we have established that leadership is very important from the get-go of your career. So when you talk about the role of leadership in your healthcare career, the role is very, very important, and the role will always be there in whatever situation that you will be in. So I would like to put up this quote as something that I would want people in the audience to understand. And I want to tell that this quote comes from Tom Peters. Tom Peters is, can you move on to the next slide, please? Tom Peters is a business leader. So he writes a lot of books about leadership and corporate efficiency. So he said that leaders don't create more followers, they create more leaders. So this is very important, very fundamental. You need to understand that when you are a leader, it is your role to create more leaders. Your leadership should be infectious, and other people should also be comfortable to lead once they have seen how you lead and how you are able to put forth effective leadership is getting formally trained, reading more non-medical books to understand human behavior, because essentially that's what you're doing. As doctors, you are managing humans and you're managing their personalities more than their disease itself. Because if you can't manage their personality, they can't adapt to listen to what you say. So you need to adapt how you deliver your message so that they will comply. And compliance is something that is really, really important in the healthcare. Undoubtedly, when you want to enhance leadership in training in medicine, there's a lot of cost and training and involved. So, but there is a huge body of evidence that says that when you get doctors who are effective leaders, you get improved positive healthcare and patient-related outcomes. And in the end, isn't that what we all want? We all want our patients to live longer, healthier, and if you are a hospitalist, you want them to be discharged because nobody likes to stay in hospital, and everybody should have good health. And so more focus should be put on to leadership development. So this is the last slide. My last slide is all my social media accounts where I hope that people will follow me because I try to put up credible content with regards to my specialty and sometimes rant about politics, which I think is a good outlet of emotion to keep things stable and steady. And so if you want to communicate with me directly, you can follow me on all these platforms, and I will be very, very happy to communicate with you and reply to whatever questions you might have, be it career development, clinical questions, or just a random chat. I am open to that, and I hope that my talk has been understandable, and I promise the organizers that my talk shouldn't be a snooze fest. I understand that this is the first talk of the day, and you will be listening to a lot more, many more influential people later. And I think you're gonna be in for a treat, and this is a good event. Thank you very much for having me, and I think I'm open for questions.
So thank you very much, Dr. Zainal Adwin, for an eye-opening talk. So I hope that every participants who are watching this session realize that leadership is not about seniority, but it's about the aspect of transforming people and to be adaptable in different situations, and last but not least, to be empathized, to have good empathy towards people that you're working. And also, I hope that by the end of the day, the overhype of leadership has been eliminated in your minds. Now, if anyone has any questions, please feel free to send it in the comments below, because I'm sure that Dr. Zana will be very, very pleased to answer them. And we have only 15 minutes left for the Q&A session, so be quick. Okay, there is a question from Fazlini Shohada. Hi doctor, in your opinion, which type of leadership is the best? Or is it depends on the situation or event?
In my opinion, I think when you talk about leadership types, I don't really adhere to a single style of leadership, be it transformational, situational, or servant leadership. Best be adaptable. That is the most important thing. You should be able to switch between roles, between leadership styles to get the most optimum outcome. Having said that, of course, you will want to transform. You want to get people to believe in a higher cause, and you will want to also know whether your followers are ready to do that or not. So it encompasses a multitude of styles, and the key word, I guess, and I think should be what everyone is aware of is adaptable. Be very adaptable to your situation, and you can go far.
Okay, thank you very much, Doctor, for your answer. And there is another question from Ranzi. Do you need to be academically brilliant student to be a leader, especially in the medical field and medical school, etc.?
Well, in my opinion, academically brilliant is a question of credibility. Doctors tend to look at credibility a lot, and this credibility comes from being a good specialist, being a good surgeon, and automatically this puts the person on a pedestal to become a leader. But I disagree. I don't think that um, somebody needs to be brilliant academically to become a leader. You can be a normal student, no worries, no problem with that. But if you are able to affect change, if you are able to influence and motivate other people towards a common goal, be it, somebody much more senior than you, somebody younger than you, then that is what the leader should be. It's not something academic. It's more of a interpersonal sort of communication effect that you're looking for to become a leader. But that's the problem with our medical line, is that we put so much focus on seniority and clinical acumen that we forget that these are not just the cogs in the wheel. There are many more other factors to look for when you're looking for an effective leader.
Okay, thank you very much for a really good insight on that question. And there is also another question that someone asked, how to accept mistakes as a leader?
Wow. Okay. I think you need to accept mistakes whether you're a leader or not. But since I'm advocating for everybody to become a leader, to accept the mistake is effective communication, effectively listening to what is being put forth to you when you understand or being told that you have made a mistake. So you need to understand and identify the other person. Where is it coming from? When somebody tells you that you've done something wrong, being defensive is not something that you want to do. Effective communication implies that you listen to what is being said, take it all in, identify it, where is the problem, and work together to achieve a solution. So, as a leader, take it all in, take everything in, take all that people say about you, take all that people comment about you, and identify whether it is true or whether it is something that is very apparent or not. So in that way, when you are open, you are able to respond and rectify. That is my opinion when faced with mistakes.
I see. So the power of empathy really takes place in
Yes,
accepting mistakes, right,
definitely.
Doctor? A really good answer. And there's also another question from Hassan Farhan. Doctor, what is your current view in leadership values seen during this COVID-19 era?
Okay, during this pandemic, we have seen people being put to leadership roles unexpectedly. Some has done well, some has not done really good. But you try your best to get things done, and like I've said, we really need to understand that we need to work together. And when something is at fault, it is not somebody's fault; it is everybody's fault, and that should be something that is that people should understand that, and that is how we should work. So if you're asking me about my view of the leadership values during this COVID era, I think it's adaptable. People are adapting. I guess you must agree with me that the word most famously used in 2020 is unprecedented. Unprecedented. So you adapt. I think the leadership values during this era is adapting, either quickly or slowly. That is not a question, and that's it. Adapting. That is what I see happening now.
So in this case, it is more pressed on the situational type of leadership, right, doctor? Where all doctors need to adapt because the COVID-19 area is such quite a really hot issue right now since the number of cases increases.
But I guess that's the problem. The problem is we can't wait for our followers to be ready. Because situational leadership demands that the followers are ready, then we instill the leadership. It needs to be a bit more rapid, transformational way should be, and situational as well. Need to be something that we need to look forward to when we expect to become a leader during this pandemic era.
Okay, thank you for another really detailed answer. And then another question from Nurish Shoba. Doctor, as a leader, how do we accept and reject other people's opinion but not hurting their feelings in certain topics?
Well, it's always business. It's never personal when you are discussing things professionally. I guess it comes back to the development of the person. When you teach people and when you train people to become effective communicators, I guess the problem of hurting their feelings doesn't come into play. If you can effectively tell your views and the person listening is able to listen effectively and with an open mind, the question of hurting their feelings will not come. But we are human, we have feelings. Feelings tend to get hurt most of the time. So we need to understand that we need to, I guess the only way to minimize it is to effectively communicate. You need to talk, and if you agree, you need to agree, and if you disagree, you need to disagree effectively and discuss, rather than putting forth your opinion and not expecting any feedback. And that's not the right way to do it. Feedback, it's always a two-way communication. Then you get less hurt in your feelings.
So from your answer, doctor, the intrapersonal type of literacy really plays a role.
Yeah.
And that is what you mentioned in your previous slides, right? The things that
Yeah.
we should apply on medical school. Really, really good answer. So, and we have a last question. How can I actually train myself as a leader, because I am quite shy and have a low self-esteem? Somehow it holds me back from showing my true potential as a medical student.
Okay. Yeah, because like I said, we have overhyped leadership. We have made it so big that people think that they are unable to lead. So the mindset needs to change that small things matter. If you are shy, the problem with the issue with shyness is that maybe you are afraid of feedback. So when you are conditioned, when you are trained to listen effectively, to speak effectively, and you have put your expectation to a minimum, then you are not confined to being worried of failure. Because that is why a lot of people have low self-esteem, because they are worried that the outcome might be negative to them. So, when becoming a leader, redefine it. Talk about small things. Small things matter. Small things collectively will become big. So, when you are thinking in that way, you will realize that you can do it. And when you do small things, take credit for it. Be happy for it. And if small things don't go your way, it doesn't effectively work, it's okay. It's a small thing. You can go on to the next small thing. So that is how you overcome that mentality to become a better leader for in the future. Yeah.
Thank you, Doctor. So that means a matter of self-love really takes place, because when we
Yeah.
become leaders, we are going to make mistakes, and maybe we are going to take it personally, and maybe that will affect our viewpoint to be leaders in the future, right?
Yeah. From the get-go, just accept that you are going to make a mistake and people are going to correct you. I guess there's an element of ego as well that needs to be overcome when you start communicating or working. So that is something you need to overcome in terms of communication. But in terms of leadership, small things matter. Just congratulate yourself and have a good time and feel good about yourself when you achieve small things. No worries. Nobody's going to fault you for it.
Thank you for the encouragement, Doctor. And another question, Doctor, is seniority something a reality in medical healthcare environment?
Okay, as I've said just now, it sadly is. It sadly is. It's sadly something that we really adhere to, albeit to a lot of people's. I disagree with it. I don't think that seniority is something really you need to really put into a focus. I don't care about seniority. So if you are able to affect change and to get the job done, that's it. I don't care whether you are 1 year in service or nearing retirement. It doesn't matter. To me, and I think that should be how people think at this day and age. It is 2021, anyways. Seniority does not matter. If you are 60, doesn't mean you're right. If you are 26, doesn't mean you're wrong.
Okay, thank you, Doctor. I'm sorry for my previous exit. There's an internet connection error happening at my house.
No,
It's normal, unfortunately. Actually, another question. How do leaders among medical personnel handle the tension between competing political demands, especially during our current situation?
right. I don't understand competing political demands, but I guess what is trying to be asked is how you handle differences of opinion. If I'm getting myself correct, the tension as a leader, or you need to be you need to not pick a side, I guess. If you are managing or leading a team or leading group of friends who have opposing opinions, you need not be on one side. You need to put yourself in a position that you can understand both aspects of it. Let's take an example of cuti. So this another guy wants cuti at a certain date, and another guy wants another cuti at the same date. So then they start to fight about it. So you as a leader should not take a side and side immediately with one person just because his demands are more important. But you really need to understand both parties and get them understand their situation first. So a leader, when you handle tension like that, you need to understand both parties first, and then you can manage them accordingly, and then you can try and mitigate or try and solve this issue effectively. I don't know whether I'm answering the question correctly, because When it comes to political demands, I'm a bit, queasy because I don't really want to give some political statement which is backfired me.
I understand, Doctor. But that is a good answer. I hope that the participant who is asking this got the answer that they needed. And that's actually one question from Hannah June. I don't like being a leader. How to face that mentality? And actually, this mentality is quite common among people that I know, actually, Doctor.
Yeah, it's not something you need to be fixing. Like I said, it is about the overhype. Because we have looked at leadership as something so big, you are uncomfortable with leading. So change that mentality, change that thinking of leadership can only mean changing the world. Then hopefully you will realize that you are comfortable with becoming a leader. So the mindset must change. You need to make it about you, and you can do it. You can do small things and you credit for it. And that is what being a leader is all about. The smallest of achievements matter.
Yes, and this is something that Doctor has repeated over and over again. You need to appreciate even the smallest achievements. So I hope that people out there who has the previous type of mentality realize that leadership is not something that is really heavy, but actually it is quite good if you can master those three aspects, which is the transformation, situational, and also empathy. Okay, thank you very much, Dr. Zainal. We have passed our 15 minutes and there are a lot of questions. And thank you very much for those participants. And ladies and gentlemen, may I thank you for your active participation in this webinar. It is very satisfying. And by the end of this webinar, I hope that you obtain a lot of fruitful information about leadership that you can instill in your daily lives. And as John Maxwell used to say, the pessimist complains about the wind. The optimist expects it to change, but the leader adjusts the sails. Before you leave, please scan the QR code displayed later. The QR code for sign out will open for 15 minutes. Thank you very much, everyone, and I hope you enjoyed the program and stay tuned with the next session for today at 8:30 p.m. in which Dr. Khairul Hafiz will be talking about COVID-19 and vaccination in public health point of view.
Brilliant. Great. Thank you very much, everybody.
Can I call you baby? Can you be my friend? Can you be my lover up until the very end? Let me show you love. I don't pretend. Stick by my side even when the world is giving in. Oh, don't you worry. I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. This is only you, nobody knew I put you first. And for you, girl, I swear I do the worst. If you stay forever, let me hold your hand. I can feel those places in your heart no one else can. Let me show you love. I don't pretend. I'll be right here, baby. You know it's sink or swim. Oh, don't you worry. I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. Can I call you baby? Can you be my friend? Can you be my lover up until the very end? Let me show you love, oh, no pretend. Stick by my side even when the world is giving in. Oh, don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. If you stay forever, let me hold your hand. I can feel those places in your heart no one else can. Let me show you love, oh, no pretend. I'll be right here, baby, you know it's sink or swim. Oh, don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. Can I call you baby? Can you be my friend? Can you be my lover up until the very end? Let me show you love, oh, no pretend. Stick by my side even when the world is giving in. Oh, don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. If you stay forever, let me hold your hand. I can feel those places in your heart no one else can. Let me show you love, I don't pretend. I'll be right here, baby, you know it's sink or swim. Oh, don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. Can I call you baby? Can you be my friend? Can you be my lover up until the very end? Let me show you love, I don't pretend. Stick by my side even when the world is giving in. Oh, don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. If you stay forever, let me hold your hand. I can feel those places in your heart no one else can. Let me show you love, I don't pretend. I'll be right here, baby, you know it's sink or swim. Oh, don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. show you love. Oh, no pretend. Stick by my side even when the world is giving in. Oh, don't you worry. I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. If you stay forever, let me hold your hand. I can feel those places in your heart no one else can. Let me show you love. Oh, no pretend. I'll be right here, baby. You know it's sink or swim. Oh, don't you worry. I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause it's only you, nobody knew I put you first. And for you, girl, I swear I do the worst.